After assessing the patient, the provider decides to proceed with the treatment on the inpatient unit. The provider would access the patient's chart and navigate to the orders profile. From the orders profile, in order to make the outpatient power plan useful in the inpatient space, the provider needs to manage the orders. They would navigate to the chemotherapy phase and select to view excluded components. As you can see, with the view of the excluded components on, there are 3 available communication orders. The provider would select the communication order, which indicates treatment is to be delivered on the inpatient unit. For best order hygiene, the provider would next modify the pre-medications to state use patient's own supply, no. They would right-click on the pre-medication, select to modify, and change the radio dial in accordance. If this step was missed, this modification can be done from pharmacy's end. The provider would then ensure there are no modifications required for the actual chemotherapy orders. If any modifications or dose adjustments were needed, they could do that at this time. If the plan included a prescription phase, the provider would select the prescription phase. The provider would then navigate to that phase and could also see with the view excluded component selected that there is an additional order with a note type above saying the below orders are to be selected when treatment is delivered on the inpatient unit. The provider would select this corresponding order and apply the dose. Next, the provider would select the scheduling phase. They would cancel the associated infusion chemotherapy visit since the treatment is being delivered on the inpatient unit. They would right-click to cancel and discontinue. If the facility which this occurs at also has follow-up clinic visits booked, it's important to cancel the correct scheduling appointment. At this point, the provider could add any additional labs or investigations required before going ahead with treatment as an ad hoc order. The provider would also place the oncology-related nausea and vomiting power plan so that they could order the required post-antiemetic treatments. In this example, we will select that the provider wants dexamethasone 4 milligrams BID for 2 days ordered. At this point, the provider would select orders for signature. The order screen would populate with any changes that have occurred to the power plan for signature, where they could verify these were the intended changes they were wanting to make. The provider would then hit sign once they were satisfied with the changes within the plan and refresh. Once doing this, you can see that the addition of the communication order, as well as the changes to the pre-meds and the prescription phase, as well as the scheduling, have happened to the order set themselves. It's important to note that the nurse would also have a nurse review for these new orders that were placed on the inpatient encounter. The communication order placed within the oncology power plan sends a notification to pharmacy so that they are made aware of the change for this patient to be treated within the inpatient space, or in the instance where a patient is intended to be treated with an outpatient power plan on an inpatient unit. Furthermore, it's important to note that both the prescription and the inpatient equivalent are ordered. The prescription phase itself will be activated from the nursing end when the treatment is decided with pharmacy that it is safe to give. Placing these orders does not take away the need for verbal communication between nursing and pharmacy, as well as between nursing and the outpatient facility to inform them that the patient's treatment has been canceled. Although the scheduling clerk can view these scheduling appointments, it is still required for a call to be made in case it is last-minute changes. It's important to note, upon medication admission reconciliation, which was shown earlier, if there are any documented medications by history that pertain to the oncology power plan specifically, they are to be stopped upon admission. Furthermore, as explained earlier, the nurse would be the one activating the inpatient equivalent of the prescription order once it is deemed that treatment is moving forward. This would place the medication on the MAR at the same time as the other oncology-related medications. Pharmacy would follow their same process in activating the prednisone order once they see the equivalent. So they would have two active prednisone orders, one as a prescription and one as an inpatient order. Now, once the patient was ready for discharge and the provider went to do medication reconciliation discharge, the provider would cancel any of the inpatient equivalent orders or stop those orders and would have the available prescribed order ready for the patient to use at discharge. However, if the duration of the prescription was already completed, it would not appear during the medication reconciliation upon discharge.